I have heard way too many stories of women that go through birth having no idea what to expect and ending up with interventions they later regret. However, making a birth plan has been proven to reduce interventions and bring a more positive and satisfying birth experience. I'm Nicole with New Mama Wellness, and I love researching natural pregnancy, birth, and postpartum. There are multiple studies that show that creating and using a birth plan helps you enter into your birth feeling more empowered. Why is this? It helps you to be informed and advocate for your own choices. There are so many things to learn about the birthing process the first time you give birth. So many women enter into their first birth without knowing that they can advocate for themselves and make choices. In working through a birth plan, you'll be able to learn about the different choices you can make and the options that you have, such as, do you want to move freely during labor? Do you want pain medication? What kind of environment do you want? Do you want your baby to be continuously or intermittently monitored? Processing through these questions and many others makes you an active participant in your care. You can go into birth knowing your options and being able to say yes or no. The other thing that is so valuable about having a birth plan is it helps you and your provider be on the same page before birth. When you're in the middle of labor is not the time that you want to be thinking about and making an important decision that you never even knew about, or to realize that your provider and you had vastly different priorities about your birth. So if you want to feel ready and empowered for your birth, let's plan it. This is not a thorough explanation of everything during labor or medical advice, but it is helpful to educate yourself on what will be going on during labor and some of the options that you'll have. So the first thing with birth that we're going to talk about is induction. By the year 2020, more than 30% of women were being induced for their birth. This is something that you definitely want to talk to your provider about before you come to your due date. However, there are several options that you should know about, some of them being less invasive or more invasive than others. Again, this is not medical advice, so talk to your doctor and do your own research before making your decision. One gentle way that they can encourage labor to begin is called a membrane sweep. Your doctor will separate the amniotic sac from the cervix. This is a gentle way to release the hormones needed to start labor. The next one is an amniotomy. This is also called breaking the water. Your doctor will rupture the fluid-filled sac surrounding your baby to encourage labor to either start or speed up. A common method of induction is called Pitocin. This is a synthetic form of a hormone called oxytocin, which helps to start labor. Another synthetic form of a hormone would be prostaglandin, which also induces labor. And a little different method is called a Foley balloon. Your doctor will insert this through your cervix into your uterus and inflate it with a saline solution, which encourages your cervix to begin opening. There are also many natural ways that people have been using for thousands of years to encourage their babies to come. So I encourage you to talk to your doctor about those also. Now that we've talked about induction, let's jump into talking about the actual labor. So there's 3 stages to labor and delivery. The first one is active labor. We're going to go through every option that is on a typical birth plan. We have a free birth plan that you can quickly download in the description and follow along with everything that I'm going to be describing to you. So the first option on there is IV. Do you want an IV or not? This can be used to administer water or electrolytes in case of needing to stay hydrated or needing to give medication. Another option is environment. Now, obviously, if you give birth in a hospital, there will be some things that you won't be able to control or request, but there are a lot of things that you can request. And there's some ideas on the birth plan for that. I gave birth at home. I loved being able to, create that calm environment that I wanted to give birth in. You also want to talk to them about labor tools. What labor tools do they have available? If there's specific ones that you would like to request, make sure you talk to your provider about that. Pain relief. I often hear women talk about epidurals as if it's the only pain relief option available. But there are actually many other options that do not have side effects and that can be very effective. There are some options for monitoring the baby. They can monitor the baby continuously. That would limit your movement a bit. Or they can intermittently monitor with a handheld device. And that would allow you to move about the room more freely. The last option on the birth plan in stage 1 is cervical checks. This is where your doctor will check to see how dilated your cervix is. And this will be a number from 1 to 10, with 10 being the most dilated, ready to push. Some women do not want to have cervical checks as it can increase a risk of infection. And some women don't want to know what the number is as it can just change rapidly throughout birth. So that's something you can definitely think about and let your doctor know what you want to do about that. Let's jump into stages 2 and 3, which is the pushing and delivery all the way through to the delivery of the placenta. Let's talk about pushing. So your body does have a natural urge to push that will kick in for most women. However, at hospitals, sometimes the doctor will tell you when to push. So for me, for my birth, I really wanted to listen to my body's natural urge to push and wait for that to come. However, because of the circumstances, my midwife did end up directing me and kind of coaching me in pushing, which was very helpful. If you want to watch my whole birth story, I will link it in the description. But it just goes to show that on all of these, there's always flexibility and room to change if needed. Some interventions in this stage that a doctor may use are forceps or a vacuum. That's to help the baby come out. Episiotomy is where the doctor makes a small cut in your perineum area, or they may encourage you to have a C-section, which is performing major surgery to get the baby out. So you definitely want to be informed about all of these things and making sure that your doctor's on the same page with you. These are definitely bigger interventions that you really want to research and know your options and make sure that your doctor's on the same page with you before you give birth. There are many positions that your body can be in to give birth. A lot of times we see in movies or whatever, women giving birth on their backs, but that actually is not the most effective position. Check out the birth plan to see some other options for giving birth and pushing. Cord clamping. Your baby will no longer need the placenta at a certain time after birth. Many natural birth workers advocate for delayed cord clamping, which is when they wait, usually until the cord stops pulsing, to perform that, as there are many benefits for the baby. There's also cord blood banking. If you're giving birth in a hospital, you can choose whether the doctor can use the blood from the cord and the placenta in order to help treat diseases in other individuals. Skin to skin or koala care has many benefits for the mama and baby, including bonding, warmth, and helping to get a good breastfeeding latch from the very beginning. One more thing about the placenta is you can tell them if you want to keep your placenta or not. Many women choose to encapsulate it and consume it for various benefits. The last section on the birth plan is going to be things regarding recovery and postpartum. Things like sleeping. Where do you want your baby to sleep? Do you want them in bed with you or in the bedside bassinet? Or maybe the hospital may have a nursery that you can put them in. Baby's first bath. Your baby will have a substance called vernix all over their skin. Some parents do prefer to wait to give baby their first bath, as this vernix protects the skin. Feeding. How do you plan to feed your baby? Do you plan to breastfeed? Do you plan to pump or use formula? Also, a lot of hospitals will have a lactation consultant present, which is so helpful for just learning how to breastfeed. There are some specific medical decisions, such as eye prophylaxis. Some hospitals do require this, so just check with your doctor on that one. Usually babies are also given a vitamin K shot. You can also do oral vitamin K if you're not comfortable giving them the shot. And then as far as vaccines go, typically babies are recommended to have a hepatitis B vaccine. So just think about if that's something that you want to do for your baby or not. The last thing on the birth plan to think about is visitors. And we did include that in the birth plan because it is so good to process through that beforehand. Some people prefer to be, surrounded by their family and friends and more people right after they give birth, before they leave the hospital. And some people would prefer to have it more quiet because there will be a lot going on. So just think about what you think you would prefer. You can always change your plan, but think about it beforehand so that you can be prepared. Remember, this is your birth story and you can be informed and confident going into your birth. And just remember, honor your body, mama.